Maternity nursing questions and answers for Nclex exam. Question number 11. Nurse is reporting the result of pregnant client having contraction stress test to the healthcare provider. Client had 3 contractions with no decelerations. How should this result be reported? Option A positive. Option B negative. Option C non-reactive. Option D reactive. The correct answer is option B negative. The contraction stress test helps to predict how baby will do during labor. Negative normal result. A negative result indicate that the baby's heart rate does not remain slow after the contractions, thus, the baby will not have medical concern during labor and delivery. Option A is incorrect. Positive abnormal result. Positive contraction stress test indicates that the baby's heart rate lowers down and remains slow during contractions. This can be a cause of concern during labor and delivery. Option C and D are incorrect. Non-stress test, NST, result can be either reactive or non-reactive. Reactive, the baby's heart rate increases at least 15 beats per minute above baseline for at least 15 seconds during the test. And this happens at least twice within a 20-minute period. This is good sign that the baby is getting enough oxygen and doing well. Non-reactive, the baby's heart rate doesn't increase with movement or the baby doesn't move much during the test. Question number 12. Pregnant client at 26 weeks of gestation admitted to the emergency department after a motor vehicle collision with side airbag deployment. The client's blood type is O negative. Which laboratory's test should the nurse anticipates? Option A Group B streptococcal culture. Option B indirect Coombs test. Option C venereal disease research laboratories VDRL test. Option D serum alpha-fetoprotein. The answer is option B indirect Coombs test. During pregnancy, the mother and fetus have separate blood supply mechanisms. Delivery or trauma leads to the disruption of this separation, which results in feto-maternal hemorrhage, which means the fetal blood enters into the maternal circulation. If the mother and father both are Rh negative, it won't cause the problem, but if the mother is Rh negative and father is Rh positive, there is chances of having baby with Rh positive blood type if an Rh negative mother is exposed to Rh positive fetal blood. The pregnant client develops antibodies to the Rh antigen, i.e. Rh sensitization, placing the current fetus and all future pregnancies at risk for serious complications such as hemolytic anemia. Indirect Coombs test is performed to screen for Rh sensitization anytime bleeding occurs secondary to maternal trauma. RhoGAM or Rh immunoglobulin is given to all Rh negative pregnant women at 28 WOG and within 72 hours of delivery, abortion and maternal trauma to prevent the Rh antibodies development. Once the antibodies developed, RhoGAM is not effective. Option A is incorrect. Group B streptococcal cultures are routinely collecting from perineal at 35 to 37 weeks of gestation to determine the need for antibiotics during labor to prevent neonatal infection. Option C is incorrect. A VDRL test is a routine part of prenatal care that screens for syphilis in pregnant women. The measures antibodies or proteins produced in response to the bacteria that causes syphilis, Treponema pallidum. Option D is incorrect. Serum alpha-fetoprotein is a blood test to screen for fetal neural tube defects. Question number 13. A pregnant client at 26 weeks of gestation complains the nurse that her lower back aches when she come home from the work. What type of exercise nurse should suggest the client to perform? Option A leg lifting. Option B tailor sitting. Option C shoulder circling. Option D squatting exercises. The correct answer is option B tailor sitting. Tailor sitting exercise encourages good posture and helps to strengthen the client back muscles, which ease the back pain, and it also helps to move the uterus forward and prepare the client for the process of labor. The client should be encouraged to rest periodically during the day and avoid standing or sitting in one position for a long time. Option A is incorrect. Leg lifting. It is a great way to strengthen the abdominal muscles. It targets the lower abdominal muscles and hip muscles. Option C is incorrect. Shoulder circling. This exercise can warm up the shoulders, specifically the muscles in the rotator cuff. Option D is incorrect. Squatting exercises. This exercise helps to strengthen the lower body, which can reduce discomfort and fatigue. This can also help with labor and postpartum recovery. Question number 14. A pregnant client at 42 weeks of gestation admitted to the labor and delivery unit for induction of labor. What is a predictor of a successful induction? Option A, Bishop score of 10. Option B, firm and posterior cervix. Option C, history of precipitous labor. Option D, non-reactive non-stress test. The correct answer is option A, Bishop score of 10. Bishop score is a system of pre-labor assessment that predicts how close a pregnant woman is to labor and whether induction is needed. The cervix is scored 0 to 3 on consistency, position, dilation, effacement, and station of the fetal presenting part. A higher Bishop score indicates an increased likelihood of successful induction that results in vaginal delivery. For nulliparous women, a score equal to or more than 6 to 8 usually indicates that induction will be successful. Bishop score. Option B is incorrect. A firm and posterior cervix is associated with a low Bishop score, which means a low likelihood of successful labor induction. Option C is incorrect. Precipitous labor refers as fast labor and delivery process, typically lasting less than 3 hours from the onset of regular contractions to delivery. A history of precipitous labor may indicate that the client will again experience precipitous labor once labor is established. This history of precipitous labor is not an independent predictor of successful induction. Option D is incorrect. Non-reactive non-stress test. This means that baby's heart rate did not rise as much as expected during the test. It does not provide the information about success or failure of labor induction. Question number 15. Nurse is performing the vaginal examination of a client in labor. The nurse determines that the fetus is in the left occiput anterior position and at -2 station. The nurse knows that the fetal presenting part is option A, 2 centimeters below the ischial spines. Option B, directly in line with the ischial spines. Option C, 2 centimeters above the ischial spines. Option D, there is no relationship to the ischial spines. The correct answer is 2 centimeters above the ischial spines. Fetal station is a measurement of how far a baby's presenting part has descended into the pelvis during labor. It is described in the number of centimeters above or below the spines. A presenting part above the ischial spines is designated as -1, -2 or -3. Option A is incorrect. A presenting part below the ischial spines, as +1, +2 or +3. Option B is incorrect. 0 station is when the baby's head is even with the ischial spines. The baby is said to engaged when the largest part of the head has entered the pelvis. Option D is incorrect. If the head is high and not yet engaged in the birth canal, it may float away from the physician's fingers during the vaginal exam. Question number 16. A client with eclampsia begins to experience a seizure. Which of the following would the nurse in charge do first? Option A, pad the side rails. Option B, place a pillow under the left buttock. Option C, insert a padded tongue blade into the mouth. Option D, maintain a patent airway. The correct answer is option D, maintain a patent airway. The actively seizing patients should have their airways secured to prevent aspiration and ensure adequate oxygenation to the mother and fetus. Oxygen may be administered by face mask to prevent fetal hypoxia. Option A is incorrect. Padding the side rails should be done as a precaution before a seizure, not during the seizure. Option B is incorrect. To avoid any injuries, the client should be placed on a flat and firm surface. Option C is incorrect. Nothing should be inserted inside the client's mouth to maintain airway patency and prevent obstruction and aspiration. Question number 17. A pregnant client at 8 weeks of gestation visiting antenatal clinic with the complaints of severe morning sickness. What most important information nurse should include while educating the client to alleviate severe morning sickness? Option A, sit on the side of the bed for a minute before getting up. Option B, eat some crackers before rising. Option C, drink a glass of water before rising in the morning. Option D, eat a large meal before going to bed. The answer is option B, eat some crackers before rising. Eating a few crackers or dry toast before getting out of the bed in the morning helps settle the stomach. Option A is incorrect. Getting up slowly and sitting on the side of the bed for a few minutes can help, but most important information is eating crackers before rising. Option C is incorrect. Drinking water before getting out of bed in the morning can help with morning sickness, but again most important information is to give to alleviate the morning sickness is to eat some crackers before rising from the bed. Option D is incorrect. Advise the client to eat small, frequent meals of plain foods, not large meal. Having a large meal can cause nausea and vomiting. Question number 18. The nurse is triaging the pregnant clients in the obstetric clinic. Which client should be seen by the healthcare provider first? Option A, first trimester client reporting frequent nausea and vomiting. Option B, second trimester client with urinary frequency. Option C, first trimester client with mild lower abdominal pain. Option D, third trimester client with right upper quadrant pain and nausea. Option D is correct answer. Third trimester client with right upper quadrant pain and nausea. Right upper quadrant or epigastric pain can be an indicator of HELLP syndrome, a complication of preeclampsia. HELLP syndrome, hemolysis, elevated liver enzymes, and low platelet count. HELLP syndrome affects the blood, liver. It is a medical emergency that needs quick treatment. Option A is incorrect. Nausea and vomiting during the first trimester are normal and expected findings. The excessive nausea and vomiting is known as hyperemesis gravidarum, which can lead to weight loss and dehydration and often needs hospital treatment. Option B is incorrect. Urinary frequency is normal symptom of pregnancy. Hormonal changes in early pregnancy can increase the need to urinate. The growing uterus and baby put pressure on the bladder, making it difficult to hold urine. Option C is incorrect. Mild abdominal pain in early pregnancy is usually caused expansion of the uterus, the ligaments stretching as fetus grow. Question number 19. A pregnant client at 38 weeks of gestation is scheduled for the non-stress test, NST. While taking to the nurse, the client asked the purpose of this test. What would be the most appropriate response by the nurse? Option A, this test determines whether you are ready for labor induction. Option B, this testing provides a determination of fetal age. Option C, a non-stress test assesses the fetal condition in the third trimester. Option D, a non-stress test assesses your blood pressure control. The correct answer is a non-stress test assesses the fetal condition in the third trimester. A non-stress test, NST, is a non-invasive test performed in pregnancies over 28 weeks gestation. During this procedure, fetal heart rate and uterine contractions are recorded using external electronic monitors and correlated with fetal movements as reported by the mother. This test determines the fetus's condition during the third trimester of pregnancy. Option A is incorrect. Bishop scoring system assess the cervical readiness for labor by assessing the certain factors such as cervical dilation, effacement, consistency, position and fetal station. Option B is incorrect. A non-stress test does not determine fetal age. Ultrasound in the first trimester is done to establish the gestational age. Option D is incorrect. A non-stress test does not assess the blood pressure control. Question number 20. The nurse is educating a pregnant client visiting to the antenatal clinic about how to increase fiber in her diet. Which type of food nurse should recommend? Select all that apply. Option A, bran muffin. Option B, kidney beans. Option C, brown rice. Option D, whole wheat pasta. Option E, corn. Option F, French fries. The correct answer are Option A, bran muffin, Option B, kidney beans, Option C, brown rice, Option D, whole wheat pasta, Option E, corn. Fiber-dense foods are an excellent choice for individuals who are pregnant or for non-pregnant. They prevent spikes in blood glucose. Bran, vegetables, whole wheat beans, and lentils are fiber-rich and would be appropriate to recommend to the client. Choice F is incorrect. French fries have very low nutritional value. They are rich in oil and sodium and often lead to fluid retention due to high sodium level.